Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter.
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So we did a video last week on risk of mental illness, or maybe it was 2 weeks ago. I don't know. Risk of mental illness during pregnancy. And we wanted to follow that video up with today's video. Stay tuned. You go first.
So today we're going to be talking about the risks of antidepressants, specifically antidepressants in the SSRI class in baby and mom during pregnancy. So if you're taking these medications in pregnancy, what are the risks to the baby and what are the risks to the pregnancy?
Right. Okay. So it's important to have this video after the last one because the main point we want people to know for the vast majority of cases is that these medications, specifically the SSRI class, are less risky than experiencing mental illness during pregnancy.
Yes, and when we say SSRI, we mean Selective Serotonin Reuptake Inhibitors. These are your medications like fluoxetine,
Sertraline,
citalopram,
escitalopram. Who are we forgetting?
Paxil,
Paroxetine. There are some caveats with that one.
Yeah. So when we're talking about SSRIs in pregnancy, like what we're going to be talking about today, we're mainly talking about fluoxetine, sertraline, escitalopram, and citalopram. So these are the ones that have been studied the most in pregnancy and that we have a lot of good data on, so we can fairly confidently say these are the risks and likely the only risks
that we know of. Yes. And I always come back to the caveat is the metaphor that I use is like, okay, if you have two people in a room and you give them both peanuts and both of them are fine, you're like, oh, everyone's fine with peanuts, right? But if you have 100,000 people in a room and you give them all peanuts and people have reactions, it's like, oh, we see that some people have reactions to peanuts. So the more people that you have, like in this study, in our peanut study, right, the less likely we are to miss something, right? So I think that when we have these large groups of people that we've studied, we can pretty confidently say that it's like very unlikely that we've missed something.
Yeah, and so with these medications in particular, we've had years and years and lots of studies around them. And so even though some studies might contradict each other, we kind of look at the research and the data as a whole.
Mm-hmm. Right.
So there are two main risks with taking SSRIs in pregnancy to baby and to mom.
Kind of. Right, like if you're taking a medication, you may have kind of generalized risks, like, right, you have risk of a headache or nausea or diarrhea or whatever the thing is. So there's like some more, we would call them more minor risks in taking them. But I think these are the ones that we would want to really talk about to make sure that you have informed consent about medications.
Yeah, so I guess I should correct that statement to say these are the risks, like specifically in pregnancy when these medications are taken in pregnancy. So obviously there's still the side effects and risks that can happen just in general with these medications. But for baby, the risks are, number one, persistent pulmonary hypertension of the newborn, which sounds scary.
Mm-hmm.
And essentially, this is where baby has trouble breathing right after they're born, and they need help with breathing with respiratory support. This happens in babies who are not exposed to antidepressants. It happens in about 1 in 1,000 cases. In babies who are exposed to antidepressants, we see that this risk goes up to about 2 in 1,000 cases. Mm-hmm. So although it is statistically significant, like we see this happening in studies, although some studies are mixed on it, we don't consider it clinically significant because the jump in the risk is from 1 in 1,000 to 2 in 1,000, which is still a very small risk.
Mm-hmm. And I think still less risky than experiencing depression in pregnancy.
Right. Still less risk overall to the baby than if they are to experience exposure to depression or anxiety.
So the other thing is poor neonatal adaptation or neonatal adaptation syndrome. I think there's lots of different ways of kind of that same idea. And basically, it's a baby who might be a little bit extra fussy, a baby who might have trouble feeding, and a baby who might have trouble sleeping, which to me sounds like a baby.
Yeah, it's basically the baby has a little bit harder time adjusting to being outside of the womb than the average baby. But we all know babies come out very differently.
Yeah, a lot of them struggle with that anyway, right?
Yeah.
And so I always tell my patients, like, for the vast majority of babies who have poor adaptation, the treatment is like literally snuggles. It's just hanging out with your baby, supporting them, monitoring them. The vast majority of them do not require any kind of intervention. And I don't know, babies are hard anyway, right?
So for neonatal adaptation syndrome, this happens in about 25 to 30% of babies who are exposed to antidepressants in pregnancy or SSRIs in pregnancy. And in all cases, it's time limited. So it's a time limited condition, but the vast majority resolve within 5 to 7 days, and then they're normal, or they're, on par with all the other average babies, and there's no long-term consequences. In very, very rare cases, this can be more severe, where they might need more intervention, like they might need to go to the NICU, or they might need a little bit of help with breathing or help keeping their blood sugar up. But those are really rare cases, and the vast majority of cases, there's really nothing that needs to be done other than extra snuggles.
I will also add that happens for babies not exposed to antidepressants as well. I think around 9% of babies. So it's not purely related to SSRIs during pregnancy.
Yeah, there are some studies showing that that risk is increased in people with mental illness too, just not as high as with SSRI exposure.
Right. So those are the two things that we talk about to make sure that people have a full picture of what it would be like or what their risks would be if they were to have antidepressants during pregnancy. And I think that you can see even just in the duration of this video that we have so much less to talk about than the risks of mental illness during pregnancy.
Yeah. And there's always studies coming out pointing to other risks. And again, we kind of want to look at the big picture and take those studies into account with all the other studies. And so there have been studies looking at, does it increase the risk of infertility, miscarriage? Does it increase the risk of preterm birth? Does it increase the risk of autism? Does it increase the risk of, learning disabilities? And all of these things and the research in general have been shown that they're not at increased risk.
Purely from taking the medications.
Although, in our last video, a lot of those things can be at increased risk just from the mental illness.
Mm-hmm. Right. So that's what we talk about on a daily basis, right?
Yeah.
Okay. Let us know what you want to learn about. Thank you so much for being here. Please leave us a comment. Let us know. Glad to have you here. See you soon.